On the other side, you have C5 lesion. All right. So if you have C5 lesion, we'll have to talk about the specifics of C5 first. So C5 will have some motor supply and some sensory supply and also some reflexes. And we'll need to talk about each separately. The motor supply is mainly two big muscles. And these muscles is the deltoid muscle and also the biceps muscle. So if you can think about it, deltoid, what does it do? It does an abduction of your shoulder. So you will ask your patient to do an abduction of the shoulder, and you can resist that to get an MRC or a specific bar. And on the other side, you have the biceps muscle as well. And the biceps can do an elbow flexion, So again, you will ask your patient to flex their elbow, and you will try to resist this. The sensory supply is the badge area, or it's sort of a patch that is related to the outer border or the skin overlying the deltoid muscle, or the outer border of the proximal part of the arm. Reflexes, the biceps reflex. So we talked about biceps muscle. So the biceps reflex will be mainly supplied by C5 and C6 as well. So when you're doing that, you're not only assessing C5, but also assessing C6. So looking at the text here, so deltoid muscle, it's a pure C5 nerve supply. The most important action of the deltoid muscle is shoulder abduction or abduction, which occurs with supraspinatus muscle as well. If you remember, the abduction arc, it's below 15 degrees and from 15 to 90 degrees and also above 90 degrees. So the abduction for the deltoid muscle will start from the above 90. The biceps muscle, which does an elbow flexion, the most important action for the biceps muscle is elbow flexion, and this is supplied by C5 and C6 through the musculocutaneous nerve. Therefore, to test the integrity of C5 nerve root, examine shoulder abduction and elbow flexion. Both have to be intact to clear the C5 nerve root examination. Sensory, we took that the sensation is distributed in this area, right? So in this area, this is the sensory distribution for the C5 nerve root. And then reflexes, we talked about the biceps reflex. And if you have a positive reflex, that means the muscle is intact. So deltoid muscle, we also talked about biceps muscle for elbow flexion and shoulder abduction.